Hi. I am writing to thank both the ER and ICU staff for taking such wonderful care of my Uncle Ernest, and of me remotely as I live in Boston. My uncle, who was 88, was living independently with no family in the area, and doing very well until he became suddenly ill and deteriorated very quickly. Dr. Alvarez in the ER was kind, smart, and listened to my concerns. From the minute my uncle was in the ICU, he was treated with dignity. The nurses couldn't have been kinder to either of us or my other family members. We never felt like a bother when we called. In fact, the opposite was true. Nurse Mia and Chaplain John helped us have a beautiful last call with my uncle's rabbi and several family members. They did a lot of running around for us, without complaint. Nurse Jen, who I dealt with initially, was an angel. She explained things to me thoroughly in ways that I could understand. She went above and beyond contacting his clergy and got through to her when I couldn't. She is truly exceptional at what she does. Susan at hospice listened to my concerns, took me seriously, and helped facilitate a transfer to the hospice house in Palm Bay so that my uncle could die peacefully. What you don't know about my uncle is that he was a Holocaust survivor who watched his parents taken and murdered in Auschwitz when he was just a young boy. He was then hidden on a farm in France and slept in the barn with the animals so he could survive. He could have died many times, but he didn't. He came to this country at the age of 15, went into the armed services, and then became a social worker who worked with veterans. He was a kind and gentle soul who treated everyone he met, regardless of who they were, with kindness and dignity. In light of this awful climate with the COVID-19 virus, I worried that his life wouldn't be taken seriously by the people treating him. But it most certainly was. We can't control whether we are going to die or not. We all do. But how we die matters. I wanted my uncle to have the dignified death he deserved, the one his loving parents did not get, and the staff at Vieira Hospital were a major part of allowing that to occur. We will be eternally grateful for this kindness. Please, please know how appreciative we all are. He actually called me from the ICU to tell me that the nurses were so kind, that he was okay, and that he was so appreciative for the care. I believe he knew that the end was near, but that he was in good hands. Very sincerely, Joyce.